This podcast represents the opinions of Katie Allen, PA, and guests of her show. The content is for informational purposes only and in no way sets up a patient relationship. Consult your healthcare professional for any medical questions. Now, here's Katie Allen.
Welcome to Make Me Pretty podcast. I'm Katie. I'm your host, and I've been in plastic surgery for almost 20 years, and I have today Rebecca Shori meeting with us, and she is a board certified nurse practitioner and works in aesthetics, and I feel honored to have you. She is an Allergan trainer and works currently at Casglow, and you can find that and even look, I think, get appointments with you from at casglow.com. Is that correct? Right?
Yep.
So I am excited to have you with us today. Yay. She's coming to us from New York. The lovely part about what technology can do for us. Get to talk through all these different things. Tell me how you got into aesthetics.
So it kind of fell into my lap. I was working in sports orthopedic surgery with post-surgical patients. And I was just in the hospital for about 7.5, 8 years, the first half of my career. And I was supposed to go back to school and get another degree. And then I just kind of felt burnt out about it. So I decided to not do that and exit the hospital setting. And then a friend approached me about a job that a family medicine doctor wanted to start up an aesthetic practice. He was looking for a family nurse practitioner or PAs. And so she asked me if I wanted to have a conversation with him, and we did. And honestly, the rest was history.
I'm laughing even listening to you because I'm thinking about all the people, and I know you get them too, that contact us on Instagram or whatever the source is and go, how do I get into aesthetics? And your story is similar a little to mine. I mean, more that I didn't really seek it out. I sought out a job. That was what I did. But yours, that it fell into your lap, basically, really. And then we have these folks going, how do I get in? I'm like, I don't know.
I know.
Just start praying.
It was. We got lucky. Yeah.
Somebody wanted us. I don't know. So that is really cool. So you started out at that job?
I did. I was with that. It was basically a startup. You know, what I knew later to be a startup. I just had no idea. I was looking for work. I'd exited the hospital setting. I did work briefly at a migraine clinic, which was interesting because I was learning medical Botox and aesthetic Botox kind of at the same time, but they never overlap,
right? No.
Right. In those practices, the reps don't overlap. Everything is different. The vials are different, everything. And so it was really interesting to kind of learn both at the same time. But I was just like, oh my God, like I just left the hospital. Am I crazy? My family thought I was crazy. They're like, what are you doing? Where are you working? You're doing what? Like,
throwing away your education.
Botox. Exactly. And then I was like, no, I can do this. So I worked like 5 different jobs, like all the while. And
try to make that transition
and so
work.
slowly, while we became busy. And then slowly we went from one office to 2 to 3 to 7 total. Mm-hmm. So, but I had no idea, what a startup was or that I was even a part of one. I was just like, okay, this guy is going to train me in this stuff and it's derm. And, everyone wants, derm, not really derm, but,
subject
at that point, I didn't know what the big picture was until kind of later on.
Well, you were in the hard part because you were learning and growing at the same time as the practice was.
Yeah.
Which is, to me, a lot of the gut work. Like that takes grit to get through because there's so much more learning. No one's just handing it to you. You're having to figure out the business aspect and the medicine or the medical aspect or aesthetic aspect of it.
Yeah. So actually, my boss at the time, he's only few years older than me. So, and he was in his 30s when he decided to do this. And so, it was really him. And I give him actually a lot of credit because, I can't even imagine, I can't imagine doing it now and I'm 40.
The pressure, the stress.
So, yes. And so needless to say, he did go from brown hair to gray hair.
Quickly?
Actually rather quickly, like within the first 2 to 3 years of practice, he just didn't sleep. He still does not sleep, and it is really, it's a 24/7 thing.
Any kind of business. Yeah. So since you've been in this for a while now, what would you say some of your favorite treatments are for patients?
Honestly, I I love filler. I love the way that it just revolumizes the face, replaces volume deficit, can smooth skin, just kind of fill in those valleys or create kind of bone and jawline where it's not, and it just transforms a face. It's probably my favorite. And Botox, of course, is, magical as well.
Thank you. Right now, since you brought up Botox, is that primarily the main toxin that you use? Or is that the only toxin that you use?
Yes. So Botox and Dysport were my main two neurotoxins. And then as I've moved practices, I was introduced to Jeuveau and then Daxxify, and then a little bit of Xeomin kind of sprinkled
here and there.
Here and there. Yeah. But primarily those are the two, and they are my favorite.
Agree.
I
agree with you.
Probably Botox number one.
And then filler, since we're on that, and I know that can get into a big conversation, but in general, off the front, do you have certain ones that you typically, for today, this could change tomorrow, but do you have certain ones that you typically like to use in the lips? And I say certain ones. Are there certain ones that you typically pull from? I mean, I know a lot of us were just pulling from all different kinds of things depending on the patient and things, but I just think that kind of open-ended.
So even though I am an Allergan trainer.
That's true. Sorry. Yeah.
So, I am slightly biased, but I really did kind of grow up in this industry on Allergan. We were primarily an only Allergan company. And then midway, about 2 to 3 years in, we did start incorporating the Restylane family. So I would say majority of my career was working with Allergan and then Galderma or Juvederm and Restylane. And so I think there's really nice products from both lines. So I will say, what kind of confuses me, and, as you said, we can go off topic with this, but is how kind of some providers prefer a line over the other, or kind of, I don't understand comments where they say, oh, one type of HA is going to migrate and over another. That never makes sense to me. And I think people,
I'm like, sorry, like that provider. It's the provider.
Yeah. Well, I'm just like, well, again, I was speaking with someone the other day and they were like, all Juvederm, it just migrates. So I just use Restylane. And I'm like, but they're both hyaluronic acids. So how does one, of course they all have, different properties. But I do I do love the Juvederm line and Restylane. I think they're great. I think they're consistent, and I think they're well made and high quality. So for lips, that's probably the area that I, would kind of play with most, choosing different types of fillers. So of the Juvederm line, I mean, Ultra, even dare I say Ultra Plus. I know some people are covering their ears, but I really do love that product in certain lips. And then, velour is really nice for patients who are kind of older or not really looking for the body, but more of the structure of a lip. And then, of course, Restylane, Kiss became super popular during COVID. I do like it. And then maybe like a refine in the lips. I think those are kind of my few go-tos.
I get that. Sure. I get all that stuff. Now, do you think, have you heard anything or seen things that you think have more hype to them than they are actually beneficial to the patient? Even filler, we can say, starting with filler, even whether it's anything from skin V. I tend to like all things to an extent. Almost any product line to me, there's uses.
I mean, I think there are some products that I don't utilize in my practice. But I think that they kind of are or have been kind of phased out in, everyday practice, like Belotero or even, Silk. I don't really see that, around very much. But personally, I never worked really with Belotero, but I did not hear good things about it. Again, not hating on any product. But I would say the biggest thing that I kind of wonder about is the effectiveness of PRP.
Yeah, bring that. Yeah.
That's probably like the biggest thing that I'm like, does it work? Does it?
Feel right now, as we're having this conversation, I can feel other aesthetic people coming down on us right now. I feel it. There's a lot of, especially in the tear troughs. I can't tell you the number of people that come and they go, because you don't put filler in the tear troughs because something bad's going to happen. I'm like, well, I just haven't.
So are you a big tear trough injector?
I am. I'm there's a period of time that I injected on bone, and then there's a period of time, some of us got brought in by a certain company and we're taught how to do it with a cannula. And I personally, coming from a surgical background, feel like it's difficult to take a cannula and run it up against and on that bone. Very difficult to know where you are. Or if you're above that, you can lay a little bit, but it's so difficult to not get that muscle to pull and eventually bunch it up. And you're not going to see that for a month or two. So my safest zone that I feel like is for myself that I'm not going to see an issue with later is to put a non-hydrophilic product down on the bone with a little BD needle. And it unfortunately causes a little more bruising, but I just...
Right. Exactly. Well, I mean, I just wish that there were kind of better studies, within the aesthetic field. There are the studies, that they show pretty good data for, bone grafting, especially in dentistry. I think it started in, dentistry and ortho, especially with a tooth implantation and things like that. And, now, of course, they inject into the joints. But there's for hair, regrowth and, skin rejuvenation. I personally have not heard of or seen any really good high quality studies done that demonstrate, the effectiveness of it. And usually when I see people that show me, oh, no, look at this for, baldness. And then I'm like, okay. But the patient was also on topical minoxidil,
yes,
or they were, they were on another type of botanical topical, or they were also taking, an oral like finasteride. Or so until, there's studies that only demonstrate that, I have kind of an issue, just boldly stating, yes, PRP is the only thing that's going to work, or it works, in replace of filler.
In addition to,
Exactly. I think I feel much more comfortable saying that until I have data that I, can see that shows otherwise. Then I definitely think it's an adjunct. It's, it definitely is not harmful, but like to your point, does a patient have the time or the finances to do 3, 6, 8 rounds of, tear trough injections with PRP?
That's a lot of rounds.
It's a lot of rounds.
Well, I don't know about those rounds. That's...
And you don't really know if it works,
There are some new ones coming around, some discussion, and I won't bring those up until we get a better idea. In speaking with somebody that actually used to work for Allergan, and now he's working from a different startup company. So I think I'll be curious to see. I'm not mentioning it yet because I need to see it better for myself. But I'll be curious to see if...
Is it a growth factor?
Maybe.
Product?
So
does it begin with an A?
So I think the thing is we kind of see over time and see what some things do. I always want to see the scientific study, but then I want to see it in the patients. Is that alone enough? And then I always say, even Oprah doesn't want to waste money. No one wants to waste money on things. And so I don't think it's a waste. It's just making sure that we're also getting them the thing that gives them the baseline that they're really going to see the biggest result for, and for the longest period of time if possible. Risk-wise, I definitely think it's lower risk than putting in a filler. But for me, it is not a replacement. And I'm still having trouble with that part where somebody's making it sound like it's a replacement. And I would love it that I'm proved wrong at some point. I don't mind that, whatever's good for the patient, but it's kind of interesting. Now, what about radio frequency? Are you using radio frequency in your practice?
We do have it. We have the Secret Duo, which is our radio frequency microneedle, and then with the erbium laser.
Well, I like erbium. Yes. I mean, usually, when used safely.
What areas do you see that kind of most beneficial for?
I wish we could safely turn it up around the eyes. I think
I was hoping you were going to talk about that.
I come from the plastic surgery background, so I will say I am probably a little more paranoid, and I don't know that that's just because of that, but I'm definitely paranoid with eyelids in the sense the energy to really create a tightening effect to change. When you turn something up enough on a lid to have a change, you increase the risk of getting a contracture or pulling down. If you end up with scarring on a lid, you are screwed. It is not good. I've never seen that from anything in our practice. I don't want to see it. The thing is how far do you go to get enough of a change? I don't want to be the one pushing it, meaning I'm okay with somebody else testing that on their patients. But if you go too far, you've got such a problem at hand. So, when you finish doing a laser of any sorts, if somebody's bothered by the lines afterwards, usually somebody's like, wow, it looks better. I'm like, that's the swelling. I would like to tell you, but sometimes you've got the initial swelling and then it goes down. You still have this residual swelling that's sitting there for a little while, which can make those lines look better. And if it's a higher, if you've got more of an ablative going on, well, it's going to last even further down the line, probably 4 to 6 to an extent, maybe not that much, but you've still got some of that residual. That's not the effect of the laser. That's from the swelling. And then when that goes down, now you're seeing the effect of the laser, because even that, you got to get collagen production. So in my mind, I'm thinking more like you're looking at 6 to 12 weeks before you're really seeing what it did.
Result.
I think you've got to have multiple things going on, whether it's the daily. I mean, it's lovely if you've got a little genetics mixed in there too.
Always helps.
I think it's really great for those that are a little bit less scared maybe about turning up some of the lasers around the eyelids. I have a lot of respect for those who feel comfortable doing it without taking it too far. For me, it's just how far is too far. I'm doing less of that right now. And then Profraxil is really what I was doing more of for a while with Cyton's Profraxil.
Is that similar to just like Fraxil device?
Yeah. For the rest of the face, to block them, you can do some dental blocks just because you can turn it up around the mouth. If you do some dental blocks.
Right.
I even a couple of times did a CO2 severely ablative one under blocks around the mouth. That's
for the barcode lines.
Yeah, but it's just still, that's hard for a patient to tolerate. But I'm doing less of that now because there's some higher risk when you get into that, just with hypopigmentation.
Are you doing less heat or just less lasers in general?
I'm doing less lasers in general. And that just has to do with our practice. And just kind of where I'm doing so much of the fillers and then still assisting in surgery and things. And it's just to find that time. It's just where I currently am right at this very moment. And have not seen with anything other than, and I say ablative, we all use different terms. I mean, you can have different ones that are ablative in the sense that they're taking that top, but I'm thinking about the old school. If you're getting into erbium, you're really burning through. I think that probably has the best results, but the risk of hypopigmentation that you see, and hypo, where you see really a whitening of the skin. To me, I see less of that done now. Now I'm seeing more practices are doing lasers with less downtime. I think you have a lot more of the working a lot more of your paying patients might be not working, but then you have a whole lot more women and men. But since my practice is predominantly still women, even though we have a percentage of men, but you have more people working and they just can't do the downtime and be down for 3 to 4 weeks in their house. So it's not just that the risks were higher with some of those, but also that they need to get back to work. And so instead of doing maybe one, you're doing things that have 2 or 3. And none of us want to do things that have too much risk involved.
Exactly. But I will say that I did work briefly with the secret, I think it's dual, is it called? And I think it has a CO2 and it has RFMN. And I did a double treatment on a patient and I was like, oh my God, their face is going to be like burned to a crisp for 2 weeks. It was during a training. So it was, good. Everything was all kosher and everything. And they honestly said that they were like a Fitzpatrick, like 1-2. So very fair, which I think does kind of sometimes heal a little bit faster than darker pigmented skin. But they only had like 4 days of downtime, they said, where they were like pink. So I think the devices are just in and of themselves, they're just finding ways to deliver kind of these, heavy duty results, but also with less downtime, which is pretty fascinating, especially for, a CO2 and an RF microneedle.
I do like radio frequency. We have N-mode,
is it the Morpheus
8? So I think if you're able to tell your patients what it can and can't do. I think it can have some good results. I think it is pricey for what it delivers, especially when it comes to the face and neck. I want to see some laser involved too. And so if it's one for the other, that's a little, I don't like that as much, but risks.
So what would you recommend then? What was the greatest benefit that you would say you see from Morpheus?
Let me see if I can say this. I think that you see a change in the skin that is difficult to describe what it is doing at about 8 to 12 weeks afterwards. And you look at it and you go, I don't really know, but it just is better. And when I say this, I'm avoiding a word. I don't believe it does tightening, because if you say tightening, I say it because I think there's something enough going on that you see the change in the skin. And so maybe at this very small level, you're getting a little of a tightening-ish effect, so that's what you're seeing when you're seeing more of this glow or something. You just can't put your finger on it. But I don't like to use the word tightening and things with patients, because most of us with tightening are going, oh, it's going to do this.
Like a lift.
A tighten is still like, most of us are like, tighten is like this. It's great. It also depends on what the budget is. You know, if you're one of our patients and you have more money that you're able to invest, it's great. But if we haven't done some of the other things first, then I think it's good to add it in addition to it. I think that it has, I heard somebody recently saying they were poo-pooing, and I think that it's just that it's expensive for what you're getting in return when we have some other things that are comparable that I have a lot more of a win on. So I like it. I think it's good. I think they are doing an incredible job at their marketing. But I do think that there's science behind radio frequency in general. I think it's nice that we can do something where we're trying to get a change while we're trying to avoid the skin level with things like, I'm thinking the body type portion of that as well. So you're trying to avoid it. And even with Morpheus, that they're trying to go through the skin before you deliver the energy. So we're just trying to get more energy underneath that skin instead of burning the outside of the skin. So you're trying to deliver more. I think that there is something that shows a change. I think it's difficult because as providers, you can put Botox in somebody, you can put filler in somebody at a certain price, and you're going to get that change. Morpheus and even laser, you can't guarantee what that change is going to be, because you really are relying on that person's body to produce collagen.
So
it's variable. Also, what their skin is. If they're Fitzpatrick 1 or 2, and for the rest of people listening, basically, if you're fairly fair, you can turn those settings up. Yeah, even on laser more. You can, so depending on what we're doing, depends on what settings we can use. Well, that depends on the outcome as well. How much skin, fat, whatever do they have? So to me, it goes back to the variables. What's your patient population?
What are those other things?
For collagen regeneration, for prevention of aging, or going after some of the sun's effects. You know, even are we trying to go after pigment? Are we trying to go after dark spots? Are we trying to go after that background with more of an IPL or a BBL?
My interest is in hyperpigmentation. Yes. Do you find that you have a device that you like that is pretty reliable for treating anything like sun damage or melasma even?
What I do is I send them over to the estheticians. Them on Triluma. The providers and estheticians, everybody that's working on melasma, it's difficult. And depends on the patient.
Extremely
difficult. Are they still on a medication that's causing, you just got so many variables. But sometimes I'm reaching for the Triluma because I feel like the risk is so low that can we see a change with that first with a low risk, depending on how bad it is. And I'm thinking again more of melasma. Right. And I've seen some great results on that.
Oh, it's tried and true. I find that that in my practice, it's kind of the daily kind of, the daily topicals that patients use that really do over time have kind of like the best benefit. They're cycling on hydroquinone or vitamin C serums, or even now topical tranexamide, niacinamide.
What are you using then? What are you using primarily for hyperpigmentation, since that's something you really have?
So I love the IPL, the Precision Plus. I think that's great. And like you mentioned, like anything with like a lightener, they'll cycle on and off hydroquinone. So there's a product called Remedy, actually, which is just over the counter. It has kojic acid, tranexamic. I think there's a little bit of glycolic acid, and that's super nice. And yeah, they can just use that, and a little bit of retinol. And just also daily toner, I think, is really helpful. Yeah. So
our girls are using a lot
just
of
kind
the
of the
VIP
daily.
too. I said our girls
What's
are using
that?
the VIP as well. So
It's
it's
a
nice.
really
Yeah,
nice
yeah.
one.
I like that part.
Yeah.
That's good stuff. Is
Mm-hmm.
that
Yeah, it's really
probably,
good.
when it comes to skin, I say skin treatments in general, procedures, things like that, what are you finding that you're reaching for most? Or it just, I mean, I know that's really a broad question. You're really talking about hyperpigmentation. What about lines? Any kind of rhytids?
See, that's where I think I agree with you. I think like a Fraxel or radiofrequency microneedle are kind of the two best things that I think are out there to help
Are you
treat.
using microneedling by itself without the radio frequency?
I used to, if a patient kind of is, they're a little bit darker skin tone, 3 or up, or, they're not a good candidate for radio frequency, then I would use just a regular skin pen. But, if they can handle the energy, then I would, just start kind of right away with the radio frequency.
So if we're talking about anti-aging in general, especially, so over 40 at least, and then every decade thereafter, what are some things, what are you saying, what do you think is probably some of the best tools that we have out there?
Again, it just kind of goes back to the basics, right? Skincare 101. Are we using good product? A retinol every night.
Do you have one of those that you like? Yeah. Do you have a favorite? Or
I love Alpha Ret by Skin Better.
I don't know that, so no.
Do you know that? Oh my God, Skin Better. They're like one of my favorite brands. I also love their SPF. They have tinted, non-tinted. But they have a little bit of retinol. They also have a product for around the eyes that I use myself, and it's not drying, so you don't wake up and your eyes are like crusting.
Now, can they get that? Is that prescriptive, or because this is a retinol? So I would think
no, it's all over the counter.
That's what I was thinking. And then, do you guys sell that out of your office as well, or
we do sell it? Yeah, but it's available. I think like Derm Store or Skin Better site, but we also do sell it within the store.
Okay, that's awesome.
Yeah, it's great. And then I think, it starts with skincare and then, daily SPF. I mean, the basics, right?
You said that one's one of your favorite SPFs or your favorite sunscreens. Is that your favorite? Do you have a couple more that you like too? Or
I do. I think Elta, honestly, is like just a really easy, inexpensive one. You don't have to get fancy or, break the bank for a good one. As long as it's mineral or physical, that I think does make a difference. So I'd recommend patients for that. And then I think, is it MD Sciences or Solar MD? One of the two I use.
I'm like, I can picture that.
Yeah. I used that in the past, but right now I'm on a Skin Better kit.
SPF, I usually use Ulta, or I use Revisions. I still do the IntelliShade, either the original or I use the clear, which just doesn't have the color to it.
I'm a big tinted sunscreen.
What's so funny is I haven't done it until this past summer, and then I was like, oh, this is nice. This is helping tone down my red too, and then I've been using it more.
Yeah, nice. I've heard of that brand. I haven't personally used it, but
it's Revision, really, so it's just an easy go-to.
And it's nice because if you just want to run out of like the house, you just have it, and it just
already put together.
Your skin looks clear and already like a first layer of something.
I agree with you. And I was trying to think of other things. So in general, when you're coming in to see patients, are you seeing them then for skincare, and you're seeing them for what does your job look like? Are you going in the OR to assist as well, or?
Oh, my OR days are typically behind me.
Good for you. I still like them. I like them too. I like a little bit of both.
I did an assist recently, but I did observe, a chin lipo recently. And I was like, oh, this is kind of like, fun, brought me back to those days. But, I don't, I don't
Yes.
need them, but it was fun, just kind of like bring back a little memory. But when I'm with my patients, I mean, they get a whole general consultation, full face, assessing skin and assessing any need for, volume, revolumization, of course,
How long
wrinkles
is
or
that visit
lifting.
usually?
Oh, it
Okay.
depends.
I'm like, how do you block out those?
Sometimes I can, I am guilty of, I think, kind of throwing kind of everything at the
Yeah, it's
patient. I'm like,
understandable.
well, we can do this and we can do
Yeah.
that. And, just because I want
Help.
to just give them all
Yeah.
options, right? If we're not a filler candidate or we're filler averse or whatever that may be, okay, let's do this. Maybe we will explore, a device, or if we have really a great foundation, we don't really have the need for volume replenishing, then we should, but we have skin texture, skin tone that needs attention, then we address that. So it's kind of whatever it is that's going to help that patient look their best and, meet their needs.
So if they make an appointment with you to come see you, do they usually do the treatments that day, or are you guys assessing and making a plan, or it just depends on the patient?
Depends on the patient, but we definitely build it in time. Like their appointment is 45 minutes. So if, whatever we can squeeze
that
in.
makes sense to me.
But I will say, like, for a first-time patient, I mean, the majority, I'm sure you feel the same way. The majority is just honestly talking, maybe 20, 30 minutes.
That's most of it. I have to tell myself to be quiet.
Yeah.
Actually, I don't tell myself to be quiet. Someone's usually knocking on my door saying, okay, how much longer?
And then, you just kind of get to just talking and you're like, oh my God, it's 45 minutes.
Goes by. Now, so when you're talking to folks and kind of you're just looking at what you need to do, I want to go into some pain things. So if you're going to do a treatment on that day and you're trying to help people with pain, let's say even on filler, do you usually use a topical? Do you ever block people?
So I don't block people, but I think that I should definitely start doing that. Just because you don't have to wait for the numbing. It doesn't last as long as the numbing. And a lot of patients, they don't want to feel the pain, but they also hate being numb for, 1 to 2 hours. That kind of happens after topical numbing. There's no kind of discoloration changes either that they get with like a BLT cream. There's no blanching effect that I find that when I'm filling, sometimes I'm like, what is that?
Yeah.
I'm like, is that just like, the lidocaine or
lidocaine? If it's lidocaine with epi, at least, because it changes the skin.
You do have some discoloration with that as well.
So and for me, it's also like if it's around the mouth, it can drop parts of the mouth. But when they're leaving, you can look a little wonky. It's possible. Not really. I mean, you really can still see, but it's just different. But it's an additional charge. And we have Pronox in our office too.
I was just about to ask you, do you use Pronox?
We have 2 machines available. Usually, I've never really had a problem with it not being available. We do charge an additional portion. Now, to me, the Pronox is about the pain, but it's more that it decreases the anxiety. Because, something that hurts badly, and I really feel that people feel pain differently. And I really do.
Are you doing that for your lips?
Lips primarily, and it's not all of them. I mean, right now, I could just, I can hear if my patients are listening to this that I have not offered it to. So some of those folks, they come in.
Everyone is going to be asking.
I know,
for
I can
Pronox
just feel
now.
this. But so if it helps somebody, it's great. I find it to be, as an injector, it's a little in the way because you've got to breathe it in. Then I need you to remove
the tube. Right.
You're immediately going to a hard suction while I'm injecting. Now, do I think it's ever caused the filler to move? No, I don't. I don't think that's occurring. But it is a little strange that you're taking something and I'm causing this trauma. And now you're going to go. And then
I would feel like that would kind of get in the way.
It does, because then you need a suction and then I need you to move. But if it helps somebody get through it and not be as anxious, it sure does seem to help people with that. The blocks, I think the idea of it is I've not seen a VO around the mouth on any of my patients personally. I think that would be a question is, have we now altered what the skin looks like? So would I be able to tell? Honestly, probably don't want to block people, but but I think you should. And for additional charge, any of my patients listening, I will block you too.
I mean, sometimes I think we should both be able to get the Pronox.
Yeah, people are going to take it down.
Do you use topical with the Pronox for the lips?
Yes.
Okay.
I always use topical. I've probably had a handful maybe or so that have gotten really red, almost
They get
Yes, and
super
I usually
red.
want to leave the
Yeah.
topical all along, but you can still have some sensitivities. And our topical plasticized, and I think it's 20% lidocaine, 7% may have been skin. I don't know. It's not in front of me right now, so I don't know for sure. But it doesn't take it all away. And I definitely think the pain, people feel pain differently. I don't think it's always about being mentally tough.
100%. I mean, I'm going to just be like very candid when I say this. Injections are not comfortable. You know, I always joke with my patients. I'm like, you know, we're not going for a massage.
It's going to hurt.
It's not going to feel great, but I don't think that there's any injection. I mean, I've had my whole face injected, my teardrop, my cheeks, my nasolabial folds, my jawline, my chin, my lips, you name it, it's been done, except the temples. That's probably next.
Yeah.
But I don't find, me personally, I don't find it unbearable. But I mean, I have patients that,
I'm laughing. I'm like, my lips are coming, but my lips haven't been done. I've done Botox to the upper lip, but I have not put filler on my lips now yet, and it's coming.
You don't have filler in your lips?
I have Botox that I just put in my upper lip that gives me a little flip.
Oh my God.
I've always had full lips, but you know, they start going down.
Your lips look amazing. I would have thought that you had like a little zhuzh in there.
This is being nice to me, but you know, you can see that with time, the lip starts to look almost dehydrated. And if you could see me in person, you can see that better. That it just, you don't, like I wouldn't have the smoothness that you would have of the lip. And that's not that's what our intention is, but you know, but eventually
you might like Skin Vive off label.
You know, somebody else was just saying I haven't done Skin Vive on anybody's lips.
It's actually super nice, exactly for like what you're talking about. You wouldn't even need like the whole syringe. You do like a half syringe and it's just enough. Because do you want volume?
No.
I feel like you would just want like the hydration.
Yeah, I want the hydration. And the bottom lip doesn't have anything going on. So as we all know, that top gets flipped out. And even with the Botox, it can almost make it look a little puffy at times, even though that's the Botox. But still we see, you know, you wake up some mornings, you go, oh, that's a little puffy. Then I just want the bottom to match that. And because of the
match it.
So Botox in the upper lip, I'm not getting any collagen formation from that. I'm just reducing those lines being produced. And just from the years of doing it, I think I should at least put a little filler in there with at least a BD needle. You know, just
like a little like smidge. Just like try the half of Skin Vive. I feel like you'll love it.
If not, I'm going to call you back up. Or I'll get Rebecca on the phone. No, it's good.
I'm like, Katie, who?
I do like Skin Vive, by the way. I put it in my neck, and been putting it in other people's too. But
I did too.
You do it on other people versus then you do it on yourself, and I go, oh, I did create some bumps by doing it on myself.
I was gonna just ask you. I did it in my neck. I kind of did it all over my body. I did in my kneecaps.
Oh, that's a good idea. I do radius and some things in that area, but yeah, I think that's a good idea.
Meaning to get there. But it left me lumpy for quite some time.
So I had spoken with the rep at the time, and because also I knew that I could reverse it if I needed to. And then she was like, well, some of them were kind of bigger. Well, maybe I should reverse it. And she was like, you should probably reverse it. And I was like, let's just see. I'm so glad that I didn't. But it did take about the biggest of the bumps. It probably was about 3 weeks or so before it was down. It wasn't enough that you could see that much.
I was just going to say,
turn and kind of see them.
If you turn, you'll see it like in the light.
I don't now.
Yes.
You know, once I got past that, it was good. I think it's hard to not have those to an extent.
So it's interesting because I have not seen that in the face.
Yeah, no.
Like ever. But I also am like a crazy like massager with a lot of my fillers. So especially Skin Vive. So yeah, I massage big time. So they leave and like I won't be able to feel the Skin Vive at all. It will just kind of like just be like under the skin. But with the neck, you know, I knew kind of what I was getting into. It was an experiment, but I tried to. One of my colleagues injected me, and she just kind of did like the little aliquots, just like you would in the face. And the skin is just so thin,
so it just shows,
you know. But even if I was trying to like smush the crap out of it down, like between my fingers, it wouldn't. It wouldn't do it.
So I wonder, folks, maybe already doing it, and I have not been doing this with Skin Vive, is whether or not you stick it in a cannula. My concern is doing that. This is not science, by the way, what I'm about to state. is whether or not you're too deep and are you going to lose that skin V? Because really it needs to be higher to me. I mean, because really now you're out
Yeah.
of in a
So
different plane then.
I did try that. I was kind of at a talk, and one of the physicians kind of mentioned that he now just takes, for the sake of kind of time and also to help reduce bruising from just, the serial punctures from.
It just seems like you're on the wrong plane then. Am I
So I
missing
did,
that?
yeah.
Like, are we not?
No, so he did mention that he did cannula in the face. So I was like, you know what? Let me just kind of try this. And to be quite honest, like it doesn't feel the same.
If I'm using a cannula, I'm deeper. I mean, really, than I'm currently injecting the skin because I would get some resistance. So, this has to do with depth, and maybe I'm not deep enough on the skin V. But
I think so. I think it's also hard to be at that depth, also just kind of consistently fanning it throughout.
I love cannula. I love it throughout the face. I use a lot of products through there. I just wonder, Skin V is a booster, but am I, if my idea is that I'm pulling that hydration into the skin, am I too deep? Not that I'm going to hurt somebody, but am I losing the product's effectiveness? If I've now been, so what if I made it easier?
I don't think
if it didn't do what I needed to do.
Right. I personally, I don't think it belongs in the cannula but we're always a guinea pig.
And so now you had mentioned earlier, so you're a trainer for Allergan. So are you training in your area or are you training elsewhere?
Yeah. So throughout kind of the New York City area in Manhattan. Yeah. But, wherever they need me, there was talks of going to New Jersey, but yes, I've trained several practices in the area.
Do you enjoy that aspect of work, the training?
I do. I really love it. I've always loved teaching, and as a nurse, I would precept new nurses coming onto the unit. I did teach for 1 year at Columbia University, a summer semester for nurses. That was one of the many jobs that I kind of took on when I was building the practice, when I was first getting started in aesthetics. And then in my previous job, I was a lead injector and I would train and onboard any of the new hires. And that's kind of why I pursued Allergan to be a trainer for them. It's just something that I love doing. And then not only do I, help kind of other injectors, but I also learn each and every time that I do it myself. I think that that's not what I expected. And I wasn't, anticipating that. But as I started to do it more and more, and I was like, wow, I'm really kind of learning how to even make my technique even better. Yeah. So it was, it works both ways.
To me, one of the advantages the training is you're getting trained directly from the company. Have you seen anything that has been kind of an aha moment with, we were talking about Skin V, but any of the other products that you want to really share, something that you'd be like, man, I was seeing this or doing this, or treatments that you've seen that you think that have worked or not worked, either way?
I think that they have done something magician-wise with Volux. I think Volux is like one of the most interesting products that I've worked with, just because I think the way that it kind of can support a jawline, but at the same time be as malleable as it is. Like
you are an employee of Allergan saying that.
I swear, like it sounds like I'm like drinking the Kool-Aid, and like no, they did not pay me to have this.
I was like, okay,
I promise. But I mean, before Volux, it was Voluma, and again, I worked in practice in a very Allergan predominant practice for the better, part of my career, and then slowly introduce, Restylane. But I've also worked with RHA4. I did like that as well. But and of course, Restylane Lift for jawline, but I really don't find there's not a product that I feel that's on the market for jawline.
What would you say for Volux? What is a good method of treatment or some warnings that you would give some folks injecting?
No, I mean, I've heard different providers have had different experiences with the product. Mostly have been positive that I know, except for one, there was kind of an issue with nodules. I have not experienced that, and I've worked with it a fair amount. I would say the only thing is that there might be a little bit of swelling, and you kind of might see it kind of resurface in the gonial angle if you're not at the right
it is
depth.
definitely, they need to give you a little payment for that part, this plug of Volux, because that is to me a product that it caused me a little bit of a headache for a second.
Find that you could see
but
the
it
product
wasn't right away. Now, swelling wise,
it's not right away. Right away, it looks amazing.
And it definitely to me swells a lot more.
Yes.
In fact, if I would warn anybody listening that injects, even though that's not probably who's doing it, but is to be careful about how much they don't put much in the chin if you're going to at all, just because it's not comfortable. If it swells.
Right.
But the jawline, I reversed actually one person where it, actually two, where it kind of collected back here. One was one of mine and one was somebody else's. And then I had a third person that was same thing, didn't touch it. She works in my office. I did fine, softened. So that's hard to do though, if you're looking at it. And so the other ones, I don't know, but it was what you said. It wasn't at first. It came, and again, on the one person I didn't reverse, it softened. It was fine. Looks good.
Do you recommend massage?
No.
So that's a product. Like I mentioned earlier, I'm a big manipulator of product, and I find that with that, you can definitely kind of manipulate it down. And if you don't, I do think that you do run the risk of seeing it kind of sit on top of the masseter muscle when, the patient is, opening their mouth. That's probably the biggest thing that I've seen. But to me, I've not had it, for me, that was an easy fix. It just kind of massage. And, as long as they're in kind of within that 2-week window and you can still manipulate the product.
And I don't have to reverse my patients usually at all. So I think when I see anything like that, I go, what in the heck?
Yeah, I will say that with the swelling, there definitely is, I think, a little bit more robust swelling and a little bit longer period of swelling. But I really do think that it's like gives some of the most beautiful results,
and especially for the amount.
I drank the Kool-Aid.
That's okay.
I drank the Volux.
I use a lot of Radius on the jawline.
Okay,
but it has to do with having done that for years. Radius is probably the product I've used the longest. I'll use some Voluma, not as much lift in the jawline, just because I don't pick it up to use it, not because I don't think it doesn't work. But the Radius has more swelling to it. I mean, kind of.
Is that kind of your go-to for a jawline?
It depends a little bit on if somebody has an event, how close I am to the event too.
When you inject Radius, are you using a needle or cannula?
For the central kind of portion, like needle into the back area and here and up. Yes, and even though a cannula is less painful on the jawline and stuff, and safety-wise, but like when you get to here, it wants to bend around some. And so I find almost it's better to go to the needle for myself just because of control to do the periauricular area as well.
Okay.
I really like that.
I've used Radius, cheeks and jawline. And then I used to use it a lot for the non-surgical BBLs.
Yeah.
And then, but slowly then switched over to Sculptra. And then
Sculptra
I think I kind of first
Radius for the BBLs.
I think I do. Do you not get nervous about moving back to, VO? Does Radius make you nervous?
So I feel like this could be used.
It makes me nervous.
I will tell you this. I used Radius before we talked about the VOs, and I kind of alluded to that a little while ago.
Right.
When I started, there was no discussion on VOs. Right or wrong, there wasn't.
Which is crazy.
So it does not mean that I am not saying that people shouldn't be concerned. It doesn't mean that I'm not concerned. I come from a surgical background. I live in a world of paranoia all the time. I don't want to do anything that I can't correct. That there was a bump, that I actually put hyaluronidase in, and that really, if you had a problem with Radius, you should flood it with saline. I mean, that's one thing.
Yes.
But I still say, get the hyaluronidase out. So use it.
Well, there's that little bit of HA in it. Well, I think, I was introduced to Radius probably year 2, 3. So that was probably like in 2020. And I think the industry as a whole really has changed in terms of, the safety and our technique, and like you said, when, you began this, I think you said in 2005. So you have,
I was on the
20
back
years
of,
of,
I was on the back of a whole lot more collagen. And I mean,
right,
there was still a discussion of silicone. I wasn't seeing that, but it was just like,
right.
I
I
mean,
was
it's
going to
on
say,
that was a long time ago. So things have
right,
changed. I will say this as the other part too. There were this many injectors when I started.
right.
People mainly had a
Yes.
whole lot of background in aesthetic
Mhm.
type. Most people that I was like Jill Jones, was an RN who's one of Mac Daddy's, and I think she's retired now, but she's coming out of a plastic surgery background. So a lot of people that even though you didn't have very many,
Mostly were surgeons.
they had seen surgery.
Mhm.
We were, and I say it wasn't that many people. Now you have this many people injecting. So
Right. And so sheer numbers game.
and those of us who are
Mhm.
inject a whole lot more
Mhm.
patients than we did at the beginning.
The higher the likelihood that you will run into that
Yeah.
at some point. And I just think, again, to your point, there are just so many more people injecting and such a higher volume of patients being injected that, yes, with anything in medicine, just the more you do, the more that you will run into, unfortunately, complications. Yeah. But I also do think that the industry as a whole, which I'm kind of happy to see is as a newer injector, that I do think that safety and the way that we're being taught to inject, even the way we're being taught to assess faces, right? Like when I got in 2017, everyone looked just like this Instagram, like
It was
pillow face. It was all about
because
lips.
Voluma. I love Voluma. Voluma is one of the biggest products that I use, so I can say this
Yeah.
without any grief. But I will say it was because you go down one of them that they were first introducing, and it was lift the face with Voluma, the cheeks. And folks are like, now I work at a surgical practice, so at a certain point, you were going to look a lot more natural if you just get some surgery and then still volumize. But it was like folks were just like trying to lift. Like, yes, and you can't see the eyes anymore, and you're like, so you're totally right. You came in on that. That was definitely a difference.
And, now even just the way we assess the face, the way that we kind of ourselves as injectors reassess, okay, how are we injecting? Is what we're doing, is that making sense? It wasn't for a little while, and now I kind of really love the way that we've, moved away from that. And I think that patients are just looking just so much more just natural and just like better versions of themselves without looking, cartoonish or caricature version.
I don't like that.
Yeah.
I do want to, before we finish, I want to ask you this because I think there are folks, since you were talking about getting into the industry and stuff, do you have any recommendations for folks that are trying to get in? You and I were talking about this. We're at the beginning, just that we kind of landed in this in a way. I was doing a lot of trauma and things as well in the very beginning, but what do you think you could recommend to those folks trying to get into aesthetics?
So, I was thinking a lot about this today, actually. Again, us being lucky, we didn't really have to think that hard. But if I was a new injector today, I would definitely say to take initiative on your own. I would take a course, ideally a course that offers hands-on experience. I myself have taken a few of those. I also went out of my way and I reached out to some local injectors that I really liked and that I thought were influential, that were near me, and I shadowed them. And I paid my own money, and it wasn't cheap, but it's worth it. And to just kind of follow them. And I think just if you can get out and shadow as many people as you can and go to these hands-on injection trainings, I don't think that you need to go to one every weekend or every one that you see. I think that is definitely helpful. I think it shows initiative, and I think it will take some networking. Facebook has like 1 million groups, and social media is great for that. And I think eventually someone will find there will be an opportunity. There's also, again, with this just being so popular now, there are practices that are willing to hire, and I think I think those are kind of little tidbits of advice. It's not easy, but I think with persistence, and I think that setting yourself apart with showing initiative and motivation, and you just continue and stay the course, will set you apart from someone that's like, well, I've done one course and how do I get into this field? It's not just a one and done.
That's a good point. Mm-hmm. So last one on this one, I said last one, and I was like, patients. When patients are picking a provider, especially in an area, in your surrounding area in New York, there's so many people injecting. So what do you think people should look for to find a good injector? And I say an injector, good person in aesthetics, really, that they can trust as a provider. Besides yourself, obviously, they need to call you. Yes.
I mean, it just doesn't
cost a glow. You need to put in your information and get an appointment.
So as someone like you, who I have surgical background, we are providers, so our brains kind of think in a different way. But I think we're more particular, and I'm super particular with who I've gone to. I've had elective cosmetic surgery in the past, and I saw 6 different surgeons before I ended up making a decision. I would say to look for a provider that, if you can suss this out, usually it's general information or a question that you can just ask. I would say anywhere from kind of starting 3 to 5 years experience. I think that you're pretty good there. Not that someone who is newer is not a good injector. I think, for kind of more simple procedures, we start somewhere, right? I'm not poo-pooing anyone who's new, but, I would just say someone who maybe friends or family have gone to and they have good experiences, look at reviews online. And then I think, obviously, you can check their medical license. But I think aside from all those things, is your kind of feeling when you're in the room with them, the rapport, their bedside manner or chairside manner. How do you feel with them? How do they make you feel? Do they answer your questions? And then I just think good conversations are, one of the most important things to have. Ask them, it's not just, a good injector when all things are good. Ask them, do they know what to do in the event of complications? What are they and how would they help you? And someone who has good answers to those and resources, I think, is how you kind of can make that decision.
Totally agree. So if people want to find you, they need to go, is it Casglow.com? And we will have that written down there. And then what is your Instagram handle? If folks, is that kind of one of the other places they can find you?
Oh, yeah, definitely. Follow me on Instagram, NYC Beauty NP.
And I'll have it written as well, but I just wanted them to hear that. And I appreciate you so much joining me on Make Me Pretty podcast. And we'll have, again, your information will be listed so that they can contact you and get appointments with you or ask questions through Instagram. People love doing that. And then seeing good content too. They love that as well. So I will definitely have them do that so they can follow me also at Katie Allen PA on Instagram or at feelinggoodnaked.com. I think, again, we might be talking soon in the future, but thank you, Rebecca, so much for joining me today. I appreciate it. Thank you.
This was so fun. Thank you for having me.